Let's go.
Hello, this is Sizwe Podcast. My name is Patricia, and today I'm here with my co-host, Agnes.
Hi, Patricia.
How are you?
I'm good.
Good. What do we have today?
Oh, that's good. Hello, my name is Agnes, like Patricia said, and today we are privileged to have Dr. Glen with us, and this is not the first time we've had him, so we are honored. Doctor, thank you for coming.
Thank you. Thank you for having me here again.
Yes.
Thank you, Doctor, for coming again.
Oh, yeah.
Good today.
Especially her. Yeah. She's wearing my country colors.
Thanks for having me back.
Thank you. So the last time we had Dr. KB here, we talk at length about cardiovascular diseases and lifestyles and things that we do that either heighten it or make us able to control it. He spoke about three major issues like dieting, exercise, and lifestyle like smoking and drinking. And today we want to corner him again to talk about, like, summarize what we did the last time. And then today we are going to delve deeper on one of the things that really matter when we talk about cardiovascular diseases. Doctor, would you give us a sum up of what we did the last time? Others
sure.
are watching.
Thanks again, and thank you. I appreciate your time.
Thank you.
The last time I came here, we talked about a whole lot of things, and it was about cardiovascular disease and the risk factors that get people prone to cardiovascular disease. As I spoke about earlier, we talked about the modifiable risk factors and the non-modifiable risk factors.
Those terms.
Literally, the modifiable ones literally is what we can do to change it. It's changeable.
Okay.
It's modifiable.
Yeah.
And the non-modifiable, it's you cannot do anything about it.
Okay.
And we spoke last about your race, your sex, your genetics, and your age.
Yes, yeah.
These are things you cannot change.
Non-modifiable.
They are non-modifiable. You
Awesome.
cannot change all of these things. And things that are modifiable is you have an control of it.
Yes.
To change it.
Yes.
We talked about diets. We talked about having a healthy physical activity. We talked about smoking cessation and then alcohol
consumption. Yes. Yeah. So, like we said today, we will take one of the risk factors, which is physical activity that doctor talked about the other day, and then maybe dealt in depth in that topic. So we are all ears. If this is Sizwe Podcast, my name is Agnes. We are here with Dr. KB and my co-host Patricia. Yes, Patricia.
And Dr. KB, we spoke about physiotherapy. What is physiotherapy?
Well, physiotherapy literally means using various muscle bulks that we have, muscle groups that we have in our body to enhance our systems.
That's too big.
Yeah, because for me, when you talk about physiotherapy, I know I go for physio when something is hurting, or if my knees are hurting, or my back is aching, then I go for physiotherapy.
Yes, yeah.
Okay, so literally, like you said, when your back is aching or something is doing you or something, then you go for physiotherapy.
Yes.
We doctors recommend that in addition to medicine that we give. For example, people who have post-stroke, they have a stroke, and then after the stroke, they've lost function of one of their muscles. We recommend medication and physiotherapy for those muscle bulks. And physiotherapy, like I said, is a big house that has different rooms in it. So we can have cardio therapy, respiratory therapy, pulmonary therapy, and then exercises that you do maybe for your abdomen or for weight loss.
Okay, so for each part of the body, there are certain
of course there is
activities that you have to do to.
And the physiotherapist is the best person to advise you based on what your needs. Right. Example, when you go to the gym, there are some people who are there, they call themselves gym instructors.
Yes.
And then they'll come in, they'll ask you, so which part of your body are you trying to train? Some ladies will tell you, I want just my back, I want flat tummy, so they know what kind of exercises you do for which muscle groups that you have.
Oh.
Yeah.
Doctor, can you remind us again, you said, so the physiotherapy is the big room. And then depending on which part of your body that you want to exercise. So what are the types of physiotherapy that we have? Like I just heard you saying cardio, and then...
So the topic under discussion is cardiovascular diseases.
Yes.
Right?
Oh, okay.
And then the risk factors
Yes.
that affect these systems that we have. So physiotherapy, that I said, the type of physiotherapy that we can do for these cardiovascular diseases are the cardio exercises.
Cardio exercise, okay. And then
you can top up with respiratory, pulmonary exercises.
can we delve more into these cardio exercises that we have?
So I'll rather subdivide it into various age groups.
Oh, okay.
Right? Because you cannot tell.
Exercises have age.
Yeah, age groups. You cannot, let's say, tell an 80-year-old man to run 100 meter.
That's right. Yeah, that's
you
right.
cannot tell a 5-year-old boy or a 7-year-old boy to also run 100 meter. And then there are various types. You have the high intensity cardio exercise. You have the low intensity cardio exercises that we can do. Right. So, for example, a patient comes or a client comes 70 years and has a risk of having a cardiovascular disease. Right. Medicine, as I said earlier, is you have to have a holistic approach to it. So there's the medical part that you give the patient medicine to take. Right? And then there's the physical activity part that you also
Recommend.
So for cardio exercises, 10 to 20 minutes brisk walk, depending on the age. And then we also add flights, stairs. There are some people who, if they are like 5 floors, you can do just 2 floors, and you start having palpitations. You start having
your heart is beating faster. Okay.
So we ask you, when you take 2 flights, you just take down, cut some rest, and then you continue. Depending on your age and how and the weather, we here in Canada, it's always cold, so people don't really go out.
I don't. When it is winter, I am inborn.
Yeah. So even in winter, you can still do a whole lot of exercises with the cardio system in your room without even going outside.
Yeah.
People recommend push-ups. People recommend just jumping jacks. People just recommend just hopping in your room, and you have to do it till you start feeling having palpitations.
Okay.
Right.
Okay. Yeah.
But the problem that we have, I've been to doctors, none of them have told me about physiotherapy or physio exercise. Go for to the gym.
No.
You ask them, is it about my weight? You say no. No. Yeah. Why don't doctors do that?
When the body generates heat by itself, not the weather, in a way it kind of melts the arteriosclerosis that we talked about, those plaques.
Oh yeah, those things that you said, it get plugged into your veins. That doesn't make the blood. Yeah.
Yes. Mostly all these things that we do helps in your blood circulation, right? Because you have to circulate the blood to various parts of the body, and then having a physical activity, and even sometimes it's advisable even not to do, because some patients have, let's say, varicose veins, right? They have dilated veins in their calf muscles, and then having exercises might clog the plug, and it will move through your veins and go and cause other problems in your lungs.
Oh.
Right? Because the air that we breathe, there's gas exchange happens in the lungs.
Yes.
That's number one. And blood also goes there to take the oxygenated blood and give out the deoxygenated blood. Right. So if you have a clot that is going to your lungs to block a specific place, we call it pulmonary embolism.
Hey.
And then that one can even worsen your situation.
Guys, if you just join us, this is Sizwe podcast, and Doctor has started the terms again. We are here talking to Dr. KB, Patricia, and I, and we are talking about risk factors that can increase your cardiovascular diseases. But today we are specifically talking about
non-modifiable parts.
the
The
non-modifiable.
modifiable one, and then under the modifiable, we're talking about having a physical activity.
Okay,
active
so
physical activity.
under the modifiable one, which now I understand that some of the risk that you can do something about it, we are talking about physical activities.
Yes.
Patricia.
So, is there a suggested time for physical activity per week that I'm supposed to do, or per day?
Well, it depends. First of all, like I said, you have to know what works for you earlier. So if you see to you 5 times a week works for you, that's fine. If for you 3 times a week because of your work schedule and the time you go to bed and all that, if 3 times a week works for you, fine. And it's not about the times in a day, but it's the time regular, how regular you do.
Yes, yeah.
Right. You cannot tell me you will keep it and just do it once a week and expect an adequate resource.
No, but doctor, if I do once a week and I do it so intense, so active, like I always say, my Wednesdays I do a lot of physical activity. So for me, my Wednesday is my gym time, and I don't do anything again until the following Wednesday.
Well, if it works for you, like I said, but then if anyone has any cardiovascular risk factor that we spoke about, you should first see a doctor.
Yes, it's not just about
It's not just about listening to friends or listening to people who suggest other things to you. You should first see a doctor, and then you combine the medical treatment and the non-pharmacological treatment. You remember we talked about it the other time? There's non-pharmacological treatment, and then there's pharmacological treatment.
Hey, yeah, we can talk about it today too. Guys, if you just join us, this is Sizwe Podcast. Patricia and I are speaking to Dr. KB, and he just dropped 2 bombs. So I just I don't mean a bomb. 2 big words. Like those times you go to a doctor and then they write a prescription for you, and you go and hide at the back of the building trying to find out what is the meaning of it. I don't know how they always. Okay, so what is non-pharmacological?
Well, as the words explains itself,
Oh, okay, I got it. Yeah.
There's pharmacological treatment that's using
Medications. Yeah.
And medications, don't forget, people have herbal medications and we have orthodox medications. That's the pills that we take that doctors prescribe for patients.
Yeah.
Right. That's the pharmacological management of all these things. And we have the non-pharmacological. That's what we are talking about. The diet, the physical activity.
The physical activities, yeah.
So right now we've not even deviated. We are just having a topic, a heading for it as a non-pharmacological management of it. First was the diet we talked about, and now we're talking about physical activities
or
physiotherapy.
Yeah, that's too big a word. So Patricia, he just said exercises can be divided into age.
Yes.
So can you delve more about that before I ask my next question? Like you said, a 5-year-old cannot run. So when the patient comes to you, what are some of the exercises that you would recommend for our cardiovascular, depending on?
So right now it's just cardiovascular disease, not pulmonary. So cardiovascular disease, we recommend jogging, that's number 1. Going for walks in the evenings or in time of the day that works for you.
Okay.
Sometimes you have a brisk walk, then you just walk a little, then you brisk it up, then you walk a little. So you can have high intensity and low intensity. Jogging is not running.
Oh, okay.
No. And running is also not jogging.
Okay, can you? No, I jog. Like I run. Okay.
When you're running, you have a lot of muscle groups that are working.
Yeah, because I'm running and my
calves
my
are
head,
working,
my calves,
your biceps, triceps, everything. But even your abdomen is even working.
When I'm running.
At high intensity.
Okay.
But then when you are jogging, though all these muscle groups are working, but it's at a low intensity. And like I said, most of the symptoms that our patients present with are palpitations or difficulty in breathing and difficulty in breathing. So when you do a high intensity something, you have shortness of breath, and then you wouldn't even want to do it again.
Oh, Oh, okay.
You understand?
Okay.
So if a low intensity, you do 30 minutes, you walk, then you do 30 minutes, then you walk. You have an hour.
So you
But an hour
jog. You jog 30 minutes.
No, if it works for you, every human being and what works for the person.
Okay.
An adult can take 30 minutes, right? But some adults who cannot take 30 minutes.
30 minutes of jogging.
Yes.
Guys, if you just join us, this is Sizwe Podcast. My name is Agnes. I can do everything except exercise. But for us, especially when we come to this side of the world, because of the cold, because of the nature of our work, because we all drive, exercise is a luxury.
We even sometimes recommend our patients to buy skipping ropes.
I have one.
And the more you skip, you see
it's still
you
in the plastic.
When last have you used it?
It is still in the plastic.
You pump blood to all. We are just improving circulation. That's the main focus of the exercises that we are doing. We're just improving circulation of blood to our oxygenated blood to our various parts of the body. So skipping can be one, jogging can be one.
Running can be one.
Running
the steps.
Depending on your age and how it works for you.
Okay.
Right? Because you don't need to run to have shortness of breath.
Okay.
Yeah.
So now you said I can use the steps, I can jog, and
mostly be that we even have cars that we drive to work. Some people drive to the train station and they use the bus. That's also another way of having a physical activity, an active physical activity.
Oh.
When you get to your office and your office is in the fifth floor or the third floor, instead of using the lift, you can use the stairs, coming down and going up. Or you're engaging your muscle groups and then also improving your circulation.
So, Doc, in this, I think my other question is, when you do these physical activities, what exactly does it do to, except making your heart pumping the blood, and what other benefits do we get from?
So, thank you. It's a very nice question that you asked. I mean, there are some hormones in the body that regulates homeostasis. So we have certain hormones in the body that are released when we have various activities in our body. One is cortisol. Cortisol is a stress hormone, right? Right. And then when it's elevated or when it's increased, it triggers other hormones to also be released, like adrenaline, right? So adrenaline works with our nervous system, and it's like the fight or flight hormone. It triggers it, and then you feel like you want to run, you want to do this, and sometimes also it increases your heartbeat because of the adrenaline gush that it will get. So some exercises, even though it is increasing adrenaline, but it is, you remember when you are stressed and you just go for a walk, you feel better.
So what's it? what's the magic there?
Yeah, so we have hormones that are released, and we have counter hormones also that are released to counter the actions of these hormones. Right? You understand? So, for example, as I talked earlier about the cortisol, there's a hormone called dopamine. That also is like an excitatory hormone. It makes you happy.
The dopamine,
right? Dopamine, and it is extracted from various substances that I'm not mentioning it now.
Okay.
Right. And we have counter-regulatory ones too, like serotonin. Serotonin, like let's say, I want to have a nice way to say it. Let's say you are having something. This is nice. I want more of it. This is nice. I want more of it. And this is nice. I don't want it anymore. So dopamine is, this is nice. I want more of it. And then serotonin is, this is nice.
I am okay with it.
I don't want it anymore. So you can see that you are doing something for a time. You like it. You want to do it more. But at the same time, it will get a time you like it, but you don't want it anymore. You get tired of it.
You are sick of it.
You are sick of it.
Yes.
So these hormones are in the body to kind of regulate like I said, the homeostasis that I talked about, your cortisol, your dopamine, and then your serotonin. You understand? Cortisol, like I said earlier, is a stress hormone, and if as it goes up, it triggers other hormones to also to be released, right? And then the dopamine is nice. I want more of it. So people get it from alcohol. People get it from smoking of other substances, right?
But when you talk about serotonin and dopamine, I think of antidepressants.
These are agents that we use in managing patients like that with depression or with psychological problems.
Okay.
And so you are saying that with exercise, some of these hormones...
With exercise, these hormones are naturally triggered without even using all these things.
Oh.
Okay.
Do you understand?
Okay, yeah. So if I go for a walk,
Yeah.
if I'm stressed and I go for a walk, I am naturally invoking these
hormones in your body to be
the
released.
stress is
It's up, and then
is
you
up.
just go for a walk, or you take a cold shower, or you just relax, count 1, 2, 3, 4, 5. It just goes.
Or call a friend.
Or call a friend to talk to a friend.
Okay, so Doc, the last time we spoke, I think I referred so much to the Dr. Bukola, and I'm bringing you back to those of us who moved from the tropics and have come to stay here, and it is cold. Patricia, how many times do you go for a run?
For a run?
Yes. How many? So what advice do you have for us?
Okay.
Yes, because for me, when the winter set in, that's the end of my physical activities. I am homebound.
Like I said earlier, it is not about going out in the cold to run. Some people do. Those who have stayed there for long, the whites, you see them doing it.
Yes.
Right? It's just about you consciously, right, trying to have a physical activity in your house, in the comfort of your room. You don't need to go out to use the skipping rope. You don't need to go out to do some squats in your house.
Yes.
You don't need to go out to do hops before you bath. You know, so it's consciously doing what works for you. And like I said earlier before this conversation, health is you have to have a holistic approach to it. You know, the spiritual part is there, the mental part is there, right, and then the physical part too is there. So you cannot concentrate on one. For example, I have headache. One will decide, I'll just pray about it. One will also say, okay, I'll take medicine. Another person will say, okay, I'll just do some exercises, right? If you concentrate on one, the possibility of it not working increases.
Okay.
But when you add all together, right, the possibility of it working now becomes realistic. So I'm not saying don't pray. I'm saying pray, but take medicine.
Okay.
And as you are taking medicine, do some physical activity. Yeah.
Yeah. So I think for we the blacks, the weather becomes a bit challenging. But the good news that Dr. KB is telling us today is you don't have any excuse. You can exercise in the comfort of your home. If you don't have the money to go and pay for gym, to get a trainer to help you do the cardio.
You know one funny thing that I wanted to just add?
Yes.
When you go to the gym,
Yes.
there are treadmills there that you can use. People are fortunate enough to buy it in their houses,
Yes.
right? And then you know what the trick, when you buy it in the house, you don't even have the trigger to even use it.
It's true. And it collects dust.
forever. Yeah.
So the fact that you just move from point A to point B, you make sure that the reason you went there, you get it.
It's true.
If it's in your house, you can be looking at it and
You're like,
Yeah. I've had it forever.
You've had it.
And that will also take you out.
That, yeah.
And if it is boring, go with a partner. So that evening walks that I was talking about, you can decide to go with a friend. Call a friend, or call your husband, call your girlfriend, call your child. And you just go for a walk. You don't even need to do any high intensity or low intensity. Just walk, take a breather, and then you'll be fine.
Yeah, before you go, doctor, there's one question that I want to ask. We have a lot of cases of high cholesterol in our community.
Yes.
What should we do about that? What is it that we are not doing right
Okay.
to have high cholesterol?
You know, cholesterol itself, we have various types of it.
Okay.
We have the good one and the bad one.
Oh, okay.
The HDL and the I mean, there are two variants.
It's a spectrum, yeah.
So when you say bad cholesterol, like I said earlier, you know, when you eat oily food and you wash your hand with just water, you still have few oil
The oil in your hand, yes, yeah.
What the soap does is it emulsifies it, breaking it down, breaking the fats down,
Okay.
so they don't feel it again.
Yeah.
Right. So there are some medications that we give, right, to help lower your cholesterol.
Oh.
And then there are things that we ourselves are doing that subconsciously we might not know. And all these things are from some types of oils that we use
Okay.
in our cooking. We have saturated oil, we have non-saturated oil. So when you are purchasing, you have to just look, right? So we have those nice ones from olive oil, you know, and other oils. I don't want to do marketing here.
It's good for us to know.
Yes, yeah.
So the kind of oil that you use in cooking also helps in that. And like I said, eating healthy, cucumber has a very high benefit in reducing high cholesterol.
Oh.
Right. And
Okay.
the other time we spoke about hydration,
Yes.
drinking water. If there are some fruits that, or food or vegetables that have a lot of water in it, cucumber is one of them.
Yeah.
So
Watermelon,
instead of
yes.
you forgetting to drink the water,
At least you.
you can just take a cucumber and then you are good to go.
Awesome.
Right.
Yeah.
So people take it as a habit that no matter what food they eat, they just take a bite of cucumber after.
But you know, as Africans, we use a lot of oil.
Yes.
And we never had cholesterol in Africa. People rarely have cholesterol. Unlike here, is it because we sit a lot, you get into your car and you're driving around?
Sedentary lifestyle, that's what we talked about. Sedentary lifestyle is also one of the one of the modifiable risk factors that we talked about. You understand? No physical activity.
Oh, okay. Okay. Okay.
Sedentary is sedentary lifestyle. It's
Okay.
white collar jobs.
Okay. You sit in an office for 7 hours. You take
Yeah.
one hour break. You come back and sit by your computer. From your computer.
That 1 hour break, you will not even go and take a walk. You just sit in his room and then maybe make a phone call. Return phone calls or return
And then you come down the stairs and
in
into your car.
an elevator.
In an elevator. Okay, if I come down the stairs, I'm doing exercise.
Oh yes.
Okay,
Yes.
Doc, people say there's a number of steps that one can take in a day that will make you know that at least I have fulfilled that part of. Is that something like
Whoa.
religiously keeping certain number of steps and then say, okay, checked?
I am not an expert in this.
Oh,
and
fair,
I can
yes.
just advise. You know, there's something called BMI, the basal body mass index, or basal mass index. That we use your weight and your height, we divide it and tell you, okay, you are obese, you are underweight, you are overweight, right? And then you are in the normal level.
Okay.
Right? So you measure, you weigh yourself in kilograms, then your height, you make the division. You can punch those values in an app, and the app will tell you, right, that it's either you are overweight or you are obese. Obesity is what we have. We don't want you to get there.
Yeah. Oh,
And
okay.
then underweight too is what we don't want you to get there.
You have to stay normal.
Because because even in literally, he said overfeeding and underfeeding are still the same.
Yeah.
Okay.
You know,
Yeah.
overfeeding and underfeeding.
Underfeeding. Yeah.
is still
You have the same risk.
yeah. So you have to make sure you're always in the balance. So many literature recommend various number of steps. But right now, every 4 in 5 people has smartphones here. And sometimes our smartphone itself calculates the number of steps we take.
Oh.
So you can give yourself okay, I want to take 1,000 steps today.
Okay.
I want to take 5. My goal is taking 5,000 steps the whole week. Right?
So you divide it throughout the 5
and
days.
then the steps, it's amazing. You might not subconsciously, you might not even know. In a day, you would have done maybe 1,005 steps.
Yeah.
Consciously, like I said, driving to the metro station, picking a metro to to your office. Then, if you see an elevator, you will not take it. Escalator, you will not take it. You use the stairs.
Yes.
And then I'm not saying do all the flights at once. If you do 2 floors and you're feeling shortness of breath, you can take a breather and then continue.
Oh, and continue.
And continue with the elevator, right?
And then mostly what I advise to people is those who don't have cars and they use buses to their homes. Instead of getting off the bus at your bus stop, you can get down maybe 2 stops or 3 stops behind and just walk to your bus stop and walk home. That's also a good idea.
That's a good exercise too. Yeah. Thank you so much. Guys, if you just join us, we are in this part of the world when it is cold. And when we talk about exercise, it's not my thing. But Doc is talking to me and Patricia today, and you are listening to us that if you want to reduce the risk, the cardiovascular risk, then you have to take control of your modifiable activities, things that you can do to add to reduce the risk of having a heart attack or all those things.
Yeah.
Patricia, before we go.
Thank you very much.
Well, the pleasure is mine, and thank you for having me here.
Thank you. I'm going to exercise.
I'm going to the gym, doctor. I promise.